Hello, everyone. This is Siddharth Ambar. Welcome to today's webinar on regenerative medicine treatments. Thank you, everyone, for joining today. As we're going along, please, if you have any questions, please leave your questions within the chat, and I will answer those questions as we're going along. Great. I see some names that I recognize here, so wonderful to see everybody today. So today we're talking about regenerative medicine treatments in the treatment of arthritis, tendinitis, injuries, and back pain. So what you'll get from this webinar is you'll learn about the best available non-surgical treatments, including using your own bone marrow and blood platelets for treatment of orthopedic issues, what is legitimate in the field of regenerative medicine, and how to choose the best physicians, clinics for regenerative medicine. So the big question is, what would you do if your pain was controlled? How would your life improve? What exercises would you restart? And what activities with family and friends would you continue to participate in? Okay, so briefly, who am I? My name is Siddharth Ambar, physician here at Chicago Arthritis and Regenerative Medicine, specialist in rheumatology, specialist also in image-guided musculoskeletal injections, in practice since 2008, actually involved in regenerative medicine since 2008, and within the Regenix network since 2012. So a little bit how I got interested in regenerative medicine. In my own training as a rheumatologist, I started to realize that a lot of the ways that we were treating patients was really not adequate. As an example, my own shoulder, I really didn't have shoulder pain when I was younger. I did play a lot of tennis. As I started to learn about musculoskeletal ultrasound, I noticed that I had a couple of minor injuries that probably been around for many years. And that got me more and more interested in tendon and ligament injuries, which made me realize that we can offer a lot more for our patients. And that then got me involved in, well, what else is available? At that point, I had started to then get involved in platelet-rich plasma, as I had a couple of very cutting-edge colleagues back in 2007 who were involved in this. And then as I noticed some good results in patients, I then started to involve other types of treatments as well, including bone marrow stem cell treatments. So the traditional care for most orthopedic issues is very inadequate. It includes things like masking the pain with pain medications, and then, or maybe even using certain injections that maybe just offer temporary pain relief, and then eventually waiting for eventual surgery. That's really just an absolutely terrible way to treat this, in that you're really not addressing what the problem is, or trying to hit that in a more long-term nature. But beyond that, there's the fact that traditional care has a lot of issues. So pain medications obviously don't fix the problem. They have tons of side effects and all sorts of societal issues that we're starting to realize. Traditional injections can give temporary relief, including steroid injections and nerve blocks. Problem is, they don't really fix the problem. And sometimes they can have issues in terms of other side effects that are really not healthy. So surgery itself can be helpful in more advanced conditions. Surgery is obviously more involved, more invasive, higher risk, potential complications that are much worse. In some very common surgeries like knee arthroscopy, it can actually accelerate arthritis, lead to more instability, has not been shown to be better than just physical therapy alone. And for those of us involved in regenerative medicine, we have a strong belief that eventually 80% of what is handled by surgery will be handled by regenerative medicine. In the same way that in cardiology, everything used to be handled with cardiac surgery, and now only 5% of cardiac issues actually get to cardiac surgery. Most things are handled through meds or nutrition or needle-based procedures. So in searching for better options, we're looking for options that either completely avoid the side effects or lower risk. They can actually improve the cause of the problem, which I'll talk about in a moment, and can actually give longer-term improvement also. So imagine reducing your pain and getting back to the activities you care about without surgery or pain medications. So regenerative medicine is the process where you utilize your own body cells to treat arthritis, tendinitis, injuries, and back pain. The normal healing process for example, let's say you have a small cut on your finger. What happens is you have platelets that infiltrate the area. Those platelets then first stop the bleeding. They then release growth factors, which then stimulate your own local stem cells. And then through inflammation, remodeling, relayering cells, you then get tissue repair. In tissues that have poor blood supply, such as tendon, cartilage, ligaments, labrum, meniscus, they tend not to heal very well on their own. Regenerative medicine is the process where we take those same cells, your own platelets and bone marrow stem cells, and coordinate the normal healing process by injecting that into the tissue that's been damaged. Now, there's a lot of subtlety and details to that, which I'll talk about, but that's kind of the big picture. So why regenerative medicine? It treats the source of the problem, which I'll talk a little bit about. Safer than surgery. It's effective for most musculoskeletal conditions. And again, eventually 80% of traditional orthopedic surgery will be replaced with regenerative medicine. So how does regenerative medicine work? Like, what's the how? Why does this work? So if you think about what's going on within a damaged joint or tendon, essentially the cells that previously were functioning well are no longer functioning well. That means the normal proteins and enzymes that they're supposed to be pumping out, they're no longer doing that. So number one, by injecting your own cells directly into the tissue that's been damaged, you can optimize the health of that tissue. You can get it to start pumping out the right kind of proteins and enzymes. So it's a healthier joint, which means a less inflamed joint. In addition, a lot of the supportive structures around a joint or a tendon, such as ligaments and other soft tissue structures, have typically become weakened over time. We treat those as well, strengthen those with these kind of treatments, and can actually give you a stronger and more functional joint as well. That increased strength of the joint will then give you better pain relief as well. And then lastly, we can also improve neuromuscular health around the joint, which makes a big difference in terms of pain as well. So I'll be talking about these as we go on for the next 30 minutes or so, but what makes a regenerative medicine expert? There's really 10 key things. Number one, your physician should be a musculoskeletal expert. And these are 10 guidelines I would recommend. Very important to be able to tell if you're really working with the right person. So a musculoskeletal expert means someone who's really focused on joint and tendon issues throughout the day, not someone who is, dealing with blood pressure in one room, somebody's skin issues in another room, and then jumping in to treat your knee or your back. That's not a musculoskeletal expert. A proper musculoskeletal expert, 100% all day, they're just focused on this. Number two, they should be a non-surgical musculoskeletal expert. My orthopedic colleagues are very well trained in surgical issues. They don't have all the right image guidance procedure techniques when it comes to these kind of treatments. And I'll talk about that in a little bit. So you really want to have a non-surgical musculoskeletal expert as well. The nature of medicine is that the more you focus on something, the better you tend to be at it. The idea of being a master of all things is really not possible in medicine. Number three, they should be using image guidance for all procedures. I have plenty of colleagues who like to tell me that they can just palpate the skin and figure out where to inject. The reality is, if you're injecting steroids, then there's enough systemic effect where it doesn't really matter where you place the needle. But when you're injecting your own cells, you have to be very precise. And I'll show you some images of how precise you need to be. They need to understand how to use inflammation to help you heal. If your physician is giving you anti-inflammatory medications, if they're using steroids, if they're applying ice after these procedures, then they don't really understand how this works. They need to understand an inflammation in the short-term window is actually helpful. They also need to understand the different types of biologic treatments that are used, and I'll talk about that. A lot of my colleagues are very much a one-size-fits-all process, and really you need to be more nuanced and better about that. They should give you personalized treatment or a bespoke treatment plan. It shouldn't be here's what we do for everyone, and that's just what we do. It should be very much tailored to you. They should understand prolotherapy and how to treat instability. I'll talk about that in a little bit. They should be transparent regarding results and your candidacy for treatment. It shouldn't be wishy-washy. It really should be, are you a good, fair, poor candidate, and what does that mean? They should follow your results long-term, and they should guide you through the process. These treatments they're not new, but they are different than what people are used to. And so your physician should have a really detailed understanding of what's involved and how to guide you through this. So certain basics with regenerative medicine, is this legal? Yes, there are some very strict guidelines from the FDA, and those guidelines are very straightforward. Number one, you need to be treating orthopedic issues. If you're treating things like kidney problems, traumatic brain injuries, these treatments are not approved for that. These treatments have been vetted from a FDA standpoint in terms of safety, and if you're treating musculoskeletal issues, that is considered kosher. Number two, when they do the lab prep, it should be all done and then re-injected within the same 24 hours. They can't hold on to it for days on end or months on end. And then number three, they should be injected the same day. They do need to be used for orthopedic issues as well, and you need to use your own cells. If you cannot use somebody else's living cells in the United States for these kind of conditions. And so that's pretty blanket across the country, and that I don't think too many people violate that. Another common question I get is, if I'm older, shouldn't I use someone else's cells? The answer is no. For the vast majority of orthopedic conditions, there's good evidence that using your own living cells is effective and appropriate and definitely safer. Is there an age limit? Simple answer is no. For most areas that we treat, the one exception are hips, where age older than 65 can be a bit worse outcome. So other regenerative medicine basics, what sort of doctor does these treatments? As I mentioned, they should be focused on musculoskeletal conditions. They should be focused on non-surgical treatments and a proper regenerative medicine expert. Can these treatments help if I've already had surgery? Yes. The one exception is if you've had a joint replaced. Then there's very limited data on can you help that out. My general rules for orthopedic surgeries: try to keep your own anatomy, avoid surgeries that cut out tissue, and always consider a regenerative medicine treatment option if you've been recommended surgery. Your physician should appropriately tell you if you're a proper candidate or not, but you should always consider that before doing a more severe surgery. So we're going to talk about some very key regenerative medicine experts and show some pictures as well. Stability is very key. So there's this concept in architecture called tensegrity. And what it means is that if you take individual units that are weak on their own, if you put them in close approximation and then compress them, the overall structure is much stronger than the individual units together. So in biology, that's called biotensegrity. Prolotherapy is this idea in medicine that if you inject your own cells into soft tissue supportive structures, you can strengthen them. By strengthening them, the layers and depth around the joint that's been injured, you get progressive strengthening over time, which then gives you better, longer lasting results in terms of pain and function, just by improving stability. So biotensegrity is a really key concept here, and prolotherapy is a very key way to understand this. So this is a case study of an individual who had lower back pain. He'd had prior surgery ×2. He still had pain, very common. You see in lower back patients. We ended up first doing platelet-rich plasma for his ligaments, facet joints, muscles, and epidural space, treating every single layer of his pathology. Initially had a mild improvement. We then ended up escalating to using his own bone marrow stem cells, and now he's dramatically better. He's 75% improved and maintaining that for the last few years. The keys here are, number one, how we can actually improve someone who's actually failed surgery. Number two, how there's different types of orthobiologics or regenerative medicine treatments that we can use. And number three, the key really being you treat every layer of the pathology. If your physician, in this case, lower back pain, if this patient only had platelets or bone marrow injected into his epidural space, he would not have had the kind of response that he had. Your physician needs to be comprehensive treatment, and in this case, we treated every layer and tissue that was involved, which has given him this better result. Orthobiologics. These are the biologic cells and tissues that we inject into your damaged area. Again, this uses a normal healing process, and again, strongly emphasize use your own living cells versus someone else's. That's where all the data really is. So platelets or platelet-rich plasma, again, involved in starting the normal healing process by using focal inflammation to stimulate your own local stem cells. There's different types of platelet preparations. This is not a one-size-fits-all process. So platelet-rich plasma works by you first do a blood draw. We then serially centrifuge and concentrate the cells that we want and then inject that into the tissue that we need to treat. The picture on the right, there's two different types of platelet-rich plasma here. The one on the left that's amber colored is high concentration of platelet-rich plasma without red blood cells. That is not as inflammatory or damaging to the tissue. On the further right side is platelet-rich plasma with a lot of red blood cells. The problem with that type of platelet-rich plasma, which is commonly used in patients in this country, is that it's more inflammatory and not ideal. You're better off getting the amber-colored one. The key is to understand that certain types of platelet concentration and preps are more appropriate than others. So we'll use a higher concentration for joints and tendons, a lower concentration for ligaments. We'll use a totally different type of platelet preparation called platelet lysate for nerves. And so having the ability to vary your concentration and dose in a way that is specific to your condition is really key. Unfortunately, is not frequently done for patients that I've seen in this country, but is certainly something that needs to be done in your care. So this is a case study, a great case study for platelets. It's a 45-year-old man referred to me with left knee pain. His physician, his sports medicine physician, had diagnosed him with patellar tendinitis. He was still having pain, and so referred to me to see if we could help him further. The picture on the right is an ultrasound. That first arrow is of the patella, the kneecap. This is the patellar tendon. And this is a lot of spurring and damage of the patellar tendon where it's originating from. So this is an example of where we injected platelet-rich plasma 2 different times into his tendon. And just to show what that looks like, again, that's the kneecap, that's the tendon, that's the needle. We're really precisely injecting into where he has his patellar tendinitis and damage. And in his case, he had 2 treatments, did great, went back to full activity, including cycling. I saw him 3 years later, where now his other leg had an issue and he had a hamstring injury and treated that, and again, back to full activity. Great example of how platelet-rich plasma is a great, number one, great first-line option and building block for a lot of things that we see in clinic. And number 2, how repeat treatment can give better effect. And then number 3, how if someone has one issue and they do well, if you need to treat something else down the line, it's a great way of being able to do that. So next are stem cells. So these are the main cells that drive repair and recovery after an injury. Again, use your own cells. That's the only thing that's allowed in the United States. Bone marrow-derived stem cells are what's legal in the US. Fat stem cells are technically illegal in the United States because there's an enzyme that's required to get that stem cell concentrate for fat cells, and that is considered unsafe and illegal by the FDA in this country. You can use fat or adipose for structural support, and we'll use that for some conditions as well. But bone marrow is really our primary way of getting stem cells. You may have heard about things like umbilical cord or amniotic cells. You don't hear so much about that now. And the reason why is because there are no living cells in those products, number one. Number 2, this has been falsely advertised as living stem cell treatment. And the Federal Trade Commission has come down on a number of clinics for that kind of false advertising. You may have heard about IV stem cells. Again, that is not happening in the US as far as I know, but there's no proven benefit for orthopedic conditions. It may be helpful for other things, but from an orthopedic condition standpoint, you stick with injecting directly into the area that's damaged. So common questions that I get for stem cell treatment outcomes. Yes, we are able to treat and improve pain and function even in advanced cases. Can we improve X-ray and MRI images? If you have advanced arthritis, we can still treat the pain and the function. We just can't get your X-ray or MRI to look like what it was 10, 20 years ago. If you have a tendon or ligament tear, and I'll show you some images of that in a moment, as long as the tear is less than 2 centimeters, we can still treat that. If you have swelling in an arthritic joint, we can treat that. If you've got a condition called avascular necrosis, we can treat that as well. Can we treat bone-on-bone arthritis? So this is a really terrible term that a lot of doctors use because it's really inaccurate. So arthritis is a biologic condition. So yes, we can still treat quote-unquote bone-on-bone arthritis. A great example of that is if you have advanced arthritis in the knees. If your range of motion is still intact, then yes, we can still treat that. Caveats to this: if you have advanced hip osteoarthritis, these patients can still benefit, but they're harder candidates. All right. And so if you've got more advanced arthritis of the hips, we generally will be discussing about referral for hip replacement. But with that said, your expectations if you have more advanced arthritis are that we can improve your pain and function, Improving imaging, however, is unlikely. So can tendon and ligament tears be treated? Great questions. This is a case study for a knee ACL tear. So if you have a partial thickness tear, definitely we can treat that. If you have a full thickness tear, in some cases we can. I'll show you an example of that. So this is a case of a 28-year-old man. He's a butcher. He had an ACL tear playing recreational volleyball. I treated him basically a couple of months later using his own bone marrow stem cells. At the 3-month mark after treatment, he was doing great. No pain, restarting activity. More importantly was his, I mean, that's the most important thing, but equally as interesting was how much improvement he had in his MRI. And I'll show that in a moment. So the picture on the right is an X-ray image of his treatment. That is his kneecap. That's his thigh bone. That's his shin bone. This is the needle. And what's lighting up here is his ACL. So you can only do this kind of injection under very high X-ray guidance. And so in this gentleman's case, this is how his MRI improved over time. And this is pretty exciting because, you know, in the past, you would not have really thought this kind of thing was possible. So the MRI on the left was before his treatment. So again, this is the kneecap, this is the thigh bone, that's the shin bone, and here is his ACL. You can see it intact down at the bottom, but as you go further up, it gets very hazy and very hard to make out anything. The radiologist has read this as likely a full thickness tear. And so the picture on the right is 3 months after his treatment. And this is his ACL now. Now you have a very clear linear structure that's well defined, that prior haziness is gone. And this is really just a great, just a really great outcome in his case, that he had not only a great subjective and functional outcome, but he's had a really great imaging outcome as well. So this is an example of a gentleman that had, his next case, a gentleman of 57-year-old man. He's a contractor. He does a lot of overhead activity. I saw him for a rotator cuff tear. So we treated him with his own bone marrow stem cells and platelets, his pre-treatment ultrasound. So on the left, this little hole right here, this little black area right here, that is a tear in the rotator cuff. And this is another version of that right here, just another view of that in the same individual. That's a pretty, that's a very clearly torn tendon. Post-treatment, 3 months after injecting his own stem cells into that area, this is what that looks like now. So that prior hole has been totally filled in. So in this case, this is a man who had not only a great imaging result, he is back to full activity, and he's also back to working full time. Great outcome. So interventional orthopedics. This is the next really key concept I need you guys to understand. This is the idea of using image guidance to treat orthopedic issues. So let's show a couple of pictures. So this is key because, as I mentioned, I have a lot of colleagues who do injections blindly. By blindly, I mean they kind of feel your shoulder, your knee, they kind of have a sense of where things are through their experience, and they stick a needle in. The thing is, that can work with a steroid injection because you have a systemic effect. But when you need to inject into tissue your own cells, you have to be so precise. You have to be at a sub-millimeter level. And this is what I'm talking about. These are two ultrasound, or these are two shoulder images. So the picture on the left is an ultrasound image. This is his rotator cuff, supraspinatus tendon. It's a very small tear in the rotator cuff. That's a needle coming in, and that's injecting directly into where that tear is. Now this is zoomed in, right? Like that small little tear here it's less than 1 centimeter by 1 centimeter. It's very small. To be able to get your needle into that spot without image guidance, I mean, it's, you know, you're really looking for a needle in a haystack. It's just not possible. So to do these kind of treatments right, you need to be very precise. The image on the right is an X-ray image, and here's a needle. This is the shoulder joint. Number one, we know we're in the shoulder joint because there's a little bit of contrast that we put into the joint to confirm that. Number two, we also injected his labrum, and this little triangular structure is his labrum. And super important because when you want to inject into labrum, how do you know you're hitting the right spot? Well, you can only do that with a high-level X-ray guidance. You cannot do that just blindly hoping to do this. And as I tell my colleagues, until I have X-ray vision with my own eyes, I'm going to be using the tools we have in the clinic, and that's what you deserve as well. So these images I showed before, image on the left is of patellar tendinitis being injected with platelets, image on the right is of ACL being injected with his own stem cells. It's another good case study. This is an ankle case study. This is a chef, 41-year-old man on his feet for 10, 12 hours at a time, starting to develop arthritis. More importantly is that he had started to develop avascular necrosis, which is essentially inflammation of the bone, which then leads to death of the bone, then eventually worse cartilage damage in the joint itself. So he underwent 3-step stem cell protocol. 3 months later, much better. His MRI images are dramatically better. Let me show you what that looks like. And 3 years out, he's still doing great. So picture on the left is pre-treatment. That white structure right there that I've labeled, that is avascular necrosis, swelling in the bone. What's problematic is that if you don't do something about that, eventually the cartilage over that bone will start to die. So this is pictured 3 months later, and that prior swelling is completely resolved. So again, we've not only treated his pain and function, but we've actually completely reversed what's driving his problem to begin with, which is the avascular necrosis. And he's back at work doing what he needs to do. So regenerative medicine treatments offer safe, effective solutions for your pain. Let me just start answering some questions because I know people have been typing in. Okay, great. Thank you, Mr. Function. Appreciate that. Obviously, I won't get into the details of your treatment, but glad to hear you're doing well, and I expect you to continue to do well as long as you're able to stay physically active. What's nice about these treatments is that if you're doing well and you're a year, 2 years down the line, and you're maintaining your physical activity, they expect you to continue to do well. There may come a point where we need to do a booster treatment, maybe just with your own platelets, but I expect you to continue to do well. Okay, somebody asked about obtaining MRIs. Can you get them? Okay, we can get your MRI reports. This is a little bit too inside baseball, but when it comes to MRI images, normally they're on the server for the radiology facility, and they don't give us access to their server. So the way for you to get that is for you to get them to burn you a CD, and then we can look at that directly. Okay, somebody asking about, do you do both PRP and stem cells? Yep. I hope we clarify the difference between platelets and stem cells. Platelets work by stimulating your own stem cells, and your stem cells, your mesenchymal stem cells, are the main cell line that really repairs damage. So asking about a wrist injury, a TFCC tear on my wrist, can that work? Absolutely. Improving not only pain, but improving the ligaments and soft tissue structures will help in your case. What if another doc wants to give you a corticosteroid injection? If you get a steroid injection, I'd recommend waiting at least a month before one of these treatments. You want to get that out of your system. The corticosteroid injections, not only can they damage the cartilage cells, they can suppress your own stem cells and platelets, and so we want to avoid that in your case. Okay, somebody asking about technical background in Vitae. Hope that's been answered. You have experience treating spondylolisthesis, stenosis, herniated discs? Yes, absolutely. We treat lower back issues all the time. Very common for us to see that kind of issue. What about nerve compression? Yep, absolutely. Again, if you have pinched nerve, you've got some degeneration in the back, very common. That's something that we treat as well. Okay. I see some more questions coming in, but let me kind of just jump back into our talk, and then I'll get back to the questions in a moment. So is this too good to be true? So there's a lot of evidence in the world of regenerative medicine now. Philip Hernigue is sort of the godfather of regenerative medicine. He is he's a French orthopedic surgeon. He has data in his patients into the mid-1990s. And he actually did studies where he would treat one joint, like a shoulder or knee, with surgery, and the other one with bone marrow. And so he literally has followed his patients out for decades. And like, he's got really amazing data that shows the effectiveness of these treatments. Regenix Network, of which I'm a part of, has data that goes back to 2005. These I have colleagues who, 10 years ago, I had colleagues who would say that they didn't think there was any effectiveness of these treatments. 10 years later, they'll now say, well, these treatments may work, but they're not sure. This field is rapidly developing, but it's not. I have personal experience since 2008, and there are definitely right and wrong ways to do this. And your expectations should be grounded in reality, evidence-based medicine. But these treatments do work, and in the right candidates, they can be very helpful. There is no such thing as magic pixie dust with what we're doing here. I mean, this is legitimate medical science, and in the right candidates, this can be very helpful. How long do results last? Regenix has data that goes 10 plus years. Philip Herningue has data that goes over 20 years. What I tell patients, however, is that if you have a chronic condition, think conservatively. If you're coming in because you've had a recent onset injury, that's one thing. If you're coming in because you've had 10 years of pain in your knee, you'll get a good result probably with treatment, but understand that if you have a chronic issue, expect that you may need a repeat treatment, a booster treatment, a few years down the line. Each person will be a little bit different. There's some people, we won't see them for 5, 7, 10 years before they need a repeat treatment. There's other people, a year later, a booster treatment would be helpful. It varies a lot from person to person. But the best ways to maintain results after treatment, number one, improve your biomechanics, work with physical therapy, do all those kind of basic things correctly that kind of got you into trouble in the first place, correct those now. Number two, there's certain supplements that we recommend for pain and inflammation and joints and tendons. And number three, repeat treatment is additive to the initial treatment, which means that as opposed to, let's say, a steroid injection, we get an immediate benefit and then back down to baseline pretty fast. These kind of treatments will slowly build up over several months, will hang in there for months to years, and you'll stay at this higher baseline. And if you need to get a second treatment or third treatment down the line, you're now building off of that higher baseline. Cost, so all important. These are not routinely covered by insurance. So to give you a sense of what your expected costs are in the United States, platelet-rich plasma generally starts at around $2,500, and using your own bone marrow stem cells starts at around $8,500. The exceptions to that would be that if your health insurance has added the Regenix corporate plan to their benefits plan. If you're interested in that, go to regenixcorporate.com. There is a growing number of private companies that are adding this to their benefits plan, to the benefit of their workers. So what I recommend is the key to determining value is, number one, is your physician and the clinic regenerative medicine experts? Number two, are you receiving what you're expecting to be receiving with treatment and the cells that they're using? And number three, this is an in-office procedure. So understand that you can avoid added costs such as hospital and surgery center fees, because they should be able to do this in the office as well. So again, I showed this slide before about what makes a regenerative medicine expert. They need to be an MSK, musculoskeletal expert. They need to be a non-surgical musculoskeletal expert. They need to be an expert in image guidance. Don't be the first patient that they're trying to figure this stuff out on, right? Like be the person where this is routine to them, and this is all that they do. Number four, they should understand how to use inflammation to help you heal. They shouldn't be using steroids and anti-inflammatory meds and ice. They should understand how to do this properly. They should understand how to use the different biologic treatments that are available. They should give you a personalized treatment plan. They should understand how prolotherapy works. In addition, they should be transparent regarding results in your candidacy. They should follow you long-term. They shouldn't just be a in and out kind of thing. And they should guide you through the process. They should have enough nuance to understand whatever questions you have for them. A little bit more about us here at Chicago Arthritis and Regenerative Medicine. We're focused on non-surgical treatments for your arthritis, tendinitis, injuries, and back pain. Starting with an evaluation, do you have signs of inflammation, instability, asymmetry, neuromuscular issues? Correct with low-risk options if possible. If not, then we kind of talk about regenerative medicine treatments using the best possible options that are available from your own body, giving you a plan that's very specifically tailored for your own condition, and then delivering those cells using the highest level image guidance possible. Okay, I see more questions coming in. Let me jump back to that. Okay, we talked about the insurance aspect. I hope that's clear. Can we treat multiple body parts at one time? Depends on which areas, depending on how many cells that we have. So we generally have less cells with bone marrow. We have much more cells with platelets. So it really depends. You can't sort of treat 6 different things at one time. So if you've got 2 knees that are problematic, what I recommend is decide on which knee is worse off. Use your own bone marrow stem cells for that. Maybe use platelets for the other. Or maybe your knee arthritis is not severe enough where you need bone marrow. You can just use your own platelets. So it depends, but sometimes we can use treat multiple areas at one time. Sometimes you're better off focusing on just one. Okay, ask about loss of range of motion. Depends on why you have loss of range of motion, right? Like if your loss of range of motion is because you got really severe arthritis that's kind of preventing the range of motion, that might be harder to treat. I've had some good results even in those kind of cases, but that generally makes you a more challenging candidate. Is your loss of range of motion, on the other hand, because you've got fluid in the joint? Well, by improving that, your range of motion will get better. Alternatively, is your range of motion diminished because you have instability, right? Because a ligament's been injured or tendon's been injured. Well, we can improve that, and you might do fine as well. Okay, Ms. Castellecchi, thank you for the question. Okay, great questions. Essentially, gist of this question is prior treatment with your own bone marrow stem cells for knees. And the question is it worthwhile to do platelets from time to time? Great question. I think it depends on how you're doing. If you find that you're at a higher plateau and you're doing well, but now you've kind of lost a little bit, then platelets would be a good kind of booster option. Deciding that kind of depends more on clinical evaluation than just MRI. All right. I think if you may be also asking the question of, is it worthwhile to do this on like a maintenance schedule? Realistically, we don't do that. It's an interesting idea in the sense that if a joint's been injured, is it worthwhile intermittently on a regular basis, putting your own cells in to treat it? It's an interesting idea, but it's not one that we really routinely do. I think if I think to myself, what would I do for myself? I mean, that's curious. I would consider that for myself, but definitely there is not really any evidence to kind of recommend that right now. But it's an interesting idea. Okay, someone else asking about payment plans. Yep, we do have options for that as well. Okay, keep on adding your questions as they come up to you. Mr. Function asking about boosters. Yeah, yes. I mean, a platelet booster will be less expensive than using your own bone marrow cells for sure. Someone else asking about Medicare. Medicare will only pay for your evaluation, follow-ups, physical therapy, imaging. They do not pay for treatments, however, unfortunately. How often do we have to get stem cells? Really depends on what your issue is, depends on how you're improving with treatment. I don't really sort of tell people that, hey, you need to get X number of treatments. In my experience, you treat someone, you give them a little bit of time to improve, and then you reassess to see if they need a repeat treatment. And in large part, that's because some people do fine with just one treatment. Other people need something on a little bit more of an ongoing basis. It really depends on the individual. Okay, wonderful. So as we start to wrap it up here, so if interested in scheduling a evaluation, there's a couple different ways to do that. There's a link that's been added. You can actually just go to that link and schedule with us directly. Alternatively, you can go to the website chicagoarthritis.com, and schedule. And I'll even leave our phone number in there as well if you want to do that. But we are available to be contacted whatever way is convenient. And okay, you see a couple more questions coming in. So someone asking about the TFCC tear, absolutely. Thought I mentioned that before, but yeah, treating wrist issues, including a TFCC tear, absolutely, it can work. Good experience with treating wrist pains and wrist problems as well. Yeah, so just kind of wrapping it up here, just some keys about how we try to treat patients here. First and foremost, integrity. Whatever treatment we're going to recommend to you is what we're using to treat literally ourselves, meaning myself, staff, friends, family. I treat my parents, my in-laws all the time. Respectful and collaborative care. These treatments are newer, so we understand you have questions. Transparency regarding candidacy for treatment, transparency regarding cost of treatment. There should be no gotchas. Offering the best options available, not just what is convenient, but really what is right for you as a human being. And of course, doing what's right for patients. So we are all patients at some level. And so, doing what's right for you is what's right for us as well. Wonderful. Well, as we're wrapping it up here, please let me know if there's any other questions. If not, I will shut things down. If you have any other questions, please contact us at your convenience. If we can be helpful in the future, look forward to meeting and helping out. Thank you for everyone's time. I hope everyone enjoys the weather and have a good day and live well. Bye-bye.